Hello and welcome. Thank you for tuning in to this edition of Bringing the World to Prince George's County. I'm Council Chair Mel Franklin, your host. Together, we are taking big steps on purpose to transform Prince George's County into a healthcare destination for the world. Stay tuned. My guests for this edition of Bringing the World to Prince George's County join me to discuss the new Regional Medical Center and big changes at MedStar Southern Maryland Hospital in Clinton. Bringing the World to Prince George's County comes your way in just a moment.
Maybe he's really focused.
Hey, Michael. Michael. Maybe he likes spinning the wheels.
Maybe he just loves trucks.
Maybe he's just being a boy.
Preoccupation with objects is one early sign of autism. Learn the others today. The sooner it's diagnosed, the better.
Welcome to Bringing the World to Prince George's County, a production of the Prince George's County Council. The world is coming, and Prince George's County is ready. Whether it's National Harbor expansion, new businesses and communities, development around our transit stations, new federal and state tenants, a new regional medical center, new entertainment venues, or a true downtown, we are becoming an innovative leader in a 21st century economy. This is Bringing the World to Prince George's County with your host, Council Chairman Mel Franklin.
Hi, and thank you for tuning in to Bringing the World to Prince George's County. This program is a production of the Prince George's County Council. I'm your host, Council Chair Mel Franklin. Bringing the World to Prince George's County focuses on our economic development success and the great work we're doing together to move Prince George's County forward. The world is coming to our county, and we will be ready. Improving access to health care for our residents not only creates healthier communities, but also presents an exciting new economic opportunity. Our efforts to build a new regional medical center and MedStar's acquisition and planned expansion of Southern Maryland Hospital combine to lead Prince George's to become a regional and national leader in health service delivery. I am thrilled to introduce my first guest, Prince George's County's Chief Administrative Officer, Brad Seamon, who has been leading the effort to build the new Regional Medical Center. Thank you for joining us on this edition of Bringing the World to Prince George's County.
Thank you.
Good to see you.
Thank you.
Well, there's a lot of interest and some great questions out there in the community about this new regional medical center that we're going to have in the county. When all is said and the regional medical center's doors are open, what do you see as kind of the most profound impact on the lives of the residents of Prince George's County, but also just the whole entire region?
Sure. I think it's important to look at it as a healthcare improvement opportunity, but also, as you've mentioned, an economic development opportunity. Sure. There's not a lot of times when you get the opportunity to do something good and then also increase your tax base, create more jobs at the same time. From a healthcare perspective, Prince George's County is in about the third quartile in the state for health status. So we have quite a bit of chronic disease and other illnesses, and bringing an academic medical center to Prince George's County. We don't have an academic medical center anywhere in the county, so you get the clinical, the research, and the academic focus that you can actually build a healthcare system around with the other hospitals that are in the county, as well as setting up primary care locations and other outpatient facilities. From an economic development standpoint, we've picked a site that's at a transit station. Right. The county council, county executive has been very vocal about wanting to develop around our metro stations. So this is kind of putting our money where our mouth is. We feel there's about $7.4 million in projects at the Largo area that were either approved or moving through. Mm-hmm. And we believe that this will be an anchor that will unlock that development.
That's outstanding. And you touched on the academic nature of this new regional medical center, and that's really a component that the University of Maryland Medical Center brings to the table. Tell us a little bit about what that means, this becoming a teaching institution as well as a hospital.
Sure. I mean, it's really important that you have, the best and the brightest, and that you are attracting medical students to the area that will later stay here, settle in the area, and become a part of the community. The academic model is important because it brings research along with it. So you're not only delivering clinical care, but you're also doing research. In the affiliation with the University of Maryland Medical System and the fact that they're academic and they have probably the best trauma center in the entire country. Right. So just affiliating with that kind of talent and experience and what it can do for our local community with respect to physicians is important.
And so one of the things with building a new hospital you have to deal with is the whole regulatory process, and that sort of stands between sort of the concept and actually putting shovels to dirt and actually beginning construction. Can you tell us a little bit about the timeline from certificate of need, which is kind of the way Maryland licenses
Right.
hospitals, to eventually the opening of the facility?
Sure. We submitted the certificate of need in October, October 4th to be exact. It goes to the Maryland Healthcare Commission. They have a process there where they go through and make sure that the application is complete. And I mean, it's a very thick application. Yeah. They make sure that everything's there before they docket it, because once they docket it, there's a timeline that starts running. You basically get up to 150 days to for them to make a decision on it. So they want to make sure it's complete. We're in that completeness phase right now. Right. There's also a component of that phase that that measures the financial viability of the projections and what have you. So there's a rate commission here in the state that sets hospital rates, which is unlike anywhere else in the country, that are involved in it as well. Once you get it docketed, like I said, you're talking about 150 days, and then we expect to be around this time next year, hopefully, to get an approval, and it then allow us to be, in the ground springish, early summer of 2015.
Great. And is it approximately a 3-year build out?
Yes.
Okay.
Yeah,
great,
it's through 2017.
Got it. And you touched on a few minutes ago sort of the ancillary impact and the impact on improving and attracting larger, or I should say, related healthcare assets. We obviously have challenges with the number of primary care physicians in the county, specialists. Can you speak a little bit to how this could really positively impact our ability to attract primary care and even specialist physicians?
Sure. Well, first and foremost, on the campus where it will be, it's a 26-acre location. The hospital takes up 4 or 5 acres, but it can be surrounded by medical office buildings. Right. So there's already, one medical office building that would be planned to be built. It wouldn't be owned by the system, most likely. It would be owned by private developer, and what that would do for us from an economic development standpoint, it was allow that part of the land to be property taxable, which we all smile about
Absolutely.
That, because the nonprofit, part of it is not. So you get that should attract your specialists and have them right there at the hospital. There are also there's another certificate of need that a lot of people don't know about that is that's in the area here for a long-term care facility, I believe it is. And so you can already see that it begins to attract. In terms of primary care physicians, again, it would be our hope that some of the residents at the medical school in Baltimore would do their rounds here as well as others, and that again they get to know Prince George's County, and it's not all the hospital systems job to bring in primary care physicians. We're about 61 short, and the county is working in concert with all the hospitals and stakeholders in the area and doing a primary care strategic plan where we're going to look for incentives and other things to convince people to stay here and build practices.
That's great news, and I know one of the things that is necessary for any endeavor like this is partnership, particularly when it comes to partnership on things like cost. And can you talk a little bit about how much the hospital will cost and kind of how the partnership that is going to help finance it, how that's organized?
Sure. The hospital is estimated to be about $650 million. Those estimates are holding at this point. And so the county is putting in a little over $200 million. The state will do the same. And the remainder of the money will come from bonds that will be issued by the hospital owner, and then those bonds will be paid back using funds that come from the hospital rates to get approved by the rate commission. So it'll be paid back out of revenues.
Gotcha. And can you speak a little bit about the state's help? We've got some great partners at the state level, and they've committed to not only the funding part, but assisting us with the overall economic development component. Can you speak a little bit about the importance of the state in all of this?
Sure. Well, first of all, the state, like the county, has been putting $15 million a year into the hospital system to subsidize it because it has so many uninsured and Medicaid patients. So that has been a huge help. And from particularly with this project, the Dr. Sharstein, who's the Secretary of Department of Health and Mental Hygiene, was involved very early and made it very clear through the MOU that this is just not about a hospital, but it's about a hospital system. And so the state has been a really good partner in keeping the fact that we need to build a system in front of all of us, because if you don't build a system that's surrounded by the primary care physicians, the specialists, the outpatient facilities, and if you also don't have the safety net there through federally qualified health centers to take care of the many patients that are going to be insured through Medicaid, then you don't have a viable project.
Right, and one of the interesting things about building a new facility like this is sort of the impact on the employees. And then, of course, the current Prince George's Hospital Center has quite a few employees, most of which probably live in the county. Can you speak a little bit about what will the changes be like for employees at the Prince George's Hospital Center, which is currently managed by Dimensions?
Well, sure. I guess first and foremost, they get the shiny new penny. I mean, they get to work in a facility that is state-of-the-art. It makes their job easier. The way the current, hospital, it's been there a long time. It's an older facility, and so it's like driving an older car instead of one that has a backup camera.
Right.
So they'll get much better working conditions. Of course, as you alluded to, they will come up the street here to the new regional medical center. So, the plan is that the employees there will just transfer here. The site there will continue to have some primary care there in an adjacent building. So we will not be leaving the Cheverly area without primary care. There will be a women's health program there as well. And so there's a 4-floor facility there, which I believe 3 of them will be taken up by a new health facility.
Well, in our final minute, I do want to mention to our audience, you are leaving the county government. You have been a truly able and outstanding leader of the executive branch in terms of your style of building consensus and bringing people together and tackling some really tough issues. So I just wanted, on behalf of the Prince George's County Council, to thank you for your leadership and your service. I know you're going back to the private sector.
I am.
And I know you'll be very successful.
Thank you very much. I've enjoyed my time.
Great. Well, I want to thank Brad Seamon for his service and significant contributions to bringing the world to Prince George's County. You've been a great guest, and it's time for a short break. Please stay with us as we continue to talk about transforming our county into a healthcare destination for the world with my next guest, Michael Chiaramonte, president of MedStar Southern Maryland Hospital Center. Bringing the world to Prince George's County returns just a moment.
It's harder whenever there's a bigger group. pretty much a good day for me would be people leaving their hands off of me. I'm always called names. Everywhere that I go, there's always someone calling me names, calling me gay. I've been choked, thrown up against a wall, punched. Nobody's ever tried to help me.
Welcome back to Bringing the World to Prince George's County, a production of the Prince George's County Council. I'm Council Chair Mel Franklin, your host. We are now joined in our conversation about Prince George's County as a healthcare destination for the world by Michael Chiaramonte, President of the MedStar Southern Maryland Hospital Center and Senior Vice President of MedStar Health. Thank you for being my guest today on Bringing the World to Prince George's County.
It's a pleasure to be with you.
Great to see you. So, I know a lot about Southern Maryland Hospital, but for many of our guests who may not, why don't you give us a little bit of the history of now MedStar Southern Maryland Hospital Center?
I'd be pleased to. The history is an interesting story and kind of a quintessential American story and a Prince George's roots story. It really tracks my father's life, the founder of Southern Maryland Hospital. Dr. Francis P. Chiaramonte opened the hospital in November of 1977 after spending medical school at Georgetown University. But you have to flash back to about 1910 when his father, my grandfather, arrived through Ellis Island as an Italian immigrant, like so many in that day, and struggled, 8th grade educated man, to save up enough money to send his son, one of two sons, to Georgetown Medical School. And that got Dr. Chiaramonte, my dad, down into this area. After completing his residency at Georgetown, he settled and opened his practice in Marlow Heights. Didn't go where many of his classmates went to the other, to Fairfax or Montgomery County. He liked the rural nature then, particularly rural nature in the 60s. So that was about 1959. And he opened his practice there on 28th Avenue behind the current Marlow Heights Shopping Center. And started. Now, in those days, he earned as a resident $25,000 a year, 6 kids. I was one of them, and a dog in the duplexes there on 28th Avenue behind Marlow Heights. So humble beginnings, hard work. We saw a guy who gave his all to his patients and his community and took care of people regardless of their ability to pay. And he taught us that this is a calling profession, this is a passion, this isn't just a job. And so he was very dedicated and focused. 15 years of that, very popular, robust practice. Folks from all over the Southern Maryland Peninsula, the lower 3 counties as well, would come up to see him because he was the first full-time urologist in Prince George's County. That took till about 59, 60. He noted, as the years went on, that there was really a dearth of specialist care all through Prince George's and the lower counties. And so he set out to build a full-service general hospital, not only for the facility of it, but to bring specialist care that were so missing and absent in that day in Prince George's and the entire peninsula.
Wow. And he, of course, built a great facility in Clinton, Maryland, in District 9. I have to put a little plug in South County. And now MedStar, who was acquired Southern Maryland Hospital, has some really exciting plans. Why don't you tell us about some of those great plans for investment in Southern Maryland Hospital?
Yes. You know, when Dr. C opened the hospital, my dad, he built a full-service general hospital, so most of the specialties were covered. And he brought his friends and colleagues out from Georgetown and George Washington Hospital and the old DC General. And so, you know, orthopedics, women's care, obstetrical care, psychiatric care were all in place back in the 70s. Since then, we've advanced it. I joined him in 1984. I'm in my 30th year there at Southern Maryland, and was not given the keys to the car at an early age, you know, so that sort of up from the bootstraps, you have to earn it mentality played out in our relationship too. So he had me in almost every job in that building over the forthcoming about 25 years. So it wasn't until 2006 that I was made the chief executive there, after really fully understanding the operation and running most aspects of the hospital. And I wouldn't have it any other way. Right. And so just in this last year, about 14 months ago, we made the decision to divest of our family's operation. Mostly estate reasons. My father was getting older, and it was time to consolidate with a bigger organization. Sure. And I think you'll see most hospitals, I predict, in Maryland within 8 years, probably every hospital will be part of a larger healthcare system. And it'll mostly be MedStar Health, the great University of Maryland system as well, and then Johns Hopkins system. Sure. As well. So MedStar Health is doing a great job with us at Southern Maryland Hospital. Their investment is significant, and it comes in two forms. There'll be about $140 million expansion and improvement of the physical plant, but and then at least $20 to $30 million in new physicians and new subspecialties. So although we brought orthopedists, now subspecialist orthopedists, hand or foot specialists. We had wonderful cardiologists, world class, but now we're bringing angioplasty, interventional cardiologists, electrophysiologists. So we're getting deeper and deeper. County residents don't have to go downtown for very much at all anymore. Wow. Our hospital, the only thing we're currently not providing is full open heart surgery, cardiac surgery, and deep intracranial kind of work that the neurosurgeons would perform. But the folks don't have to go downtown anymore. And when the new University of Maryland Dimensions Hospital is built, even those services will be covered.
Absolutely, and it is important to know that the Chiaramonte story is really an American story as well as a Prince George's County story, and so it's great the contributions your family has made to this county and to healthcare in the county, and will continue to make now even with MedStar Southern Maryland and its expansion. Why don't we talk a little bit about some of the medical needs that you find in highest demand by the residents of the county and the residents in the service area of the hospital. What are the big things that you see are healthcare needs?
Yes, of course. We have always studied our demographics, studied our disease modality kind of in an epidemiological way. And then, of course, you provide programs and services that take care of those needs. Right. And so we're unique in a sense in our county in that we do have disproportionate risk factors in and around cardiology and heart disease. Right. We have a higher rate of diabetes than most counties. We have low birth weight babies at rates similar to Caribbean islands. Now, these aren't fun, happy things to talk about, but it's important that we understand them so we can begin to attack them. Absolutely. And attack them as a team, as a group. You mentioned with your earlier guest, Mr. Seamon, that it's going to take all of us, all of the hospitals, the county health department, to come together and fill the gaps in care. None of us have the resources to do it by ourselves. Right. But if we can plan it and work it together, I must compliment the health department currently in Prince George's. 30 years here, I've seen better and worse moments, frankly, for our county's contribution. Right now, we're doing a fantastic job working in private-public partnership, leveraging the strength of Prince George's Hospital, Southern Maryland Hospital, and all of our physicians and nurses to try to, again, fill the voids and the gaps in care. So we have an awful lot of cardiology work that enters through our emergency department, right? Heart disease, heart attacks. Another statistic I think important and telling is that Southern Maryland Hospital sees more stroke last year, 750 strokes, more than any other hospital in the state of Maryland, including the University of Maryland and Johns Hopkins University Hospital. That sort of blows people away.
Yeah, that's fine.
Now we have this excellent stroke program with these wonderful neurologists and emergency room docs and it's a certified stroke program, meaning we apply a blood thinner to the ischemic strokes, the clot strokes, and open them up. And it's this miraculous moment when we're hemiplegic and the clot is dissolved and then the paralysis goes away and you see the change in expression. It's a miracle before your eyes. Beautiful. But really, it's a comment, that number, on the health of our county. And so the risk factors in the area of stroke are really diabetes and obesity.
Right.
And so those risk factors relate to what we all learned growing up about diet,
Absolutely.
exercise, some self-discipline, to try to take care of ourselves.
And so in talking about how we can better manage these many of them chronic health issues, can you speak a little bit about how the healthcare industry is changing to try to move beyond the inpatient environment to actually try to manage patients on a more holistic basis?
Sure, excellent. There are really two major issues, two giant sort of national issues in healthcare that must be addressed, and the one President Obama has gone after in a laudable way, and that's the uninsured Americans, right? 40 to 50 Americans, 50 million Americans uninsured.
Right.
You then bring that to a microcosm of this county, and you have between 80 and 100,000. Or say 950,000 residents
Right.
who have either very little insurance or no insurance at all.
Right.
Those are the folks we have to reach. Many of them are sort of invisible because they have other bigger problems, and so like homelessness or hunger,
Right.
or severe drug addiction. And so first on their plate isn't an insurance card in their pocket.
Right.
They've got sort of deeper needs, greater needs. We must touch those people, we must find those people. We've got to reach those people.
Right.
And so the industry's shifting dramatically now. We're going through a time of great consolidation because we need economies of scale in order to finance healthcare delivery.
Right.
All right, so you'll see great consolidation. You'll also see this sort of vertical integration where all levels of care are offered by the same large systems. MedStar Southern Maryland, MedStar Health in general does this quite well. So they will also seed and invest in many primary care physicians. You know, prior to the acquisition, we had about 20 physicians in maybe an 8 to 10 mile radius around our hospital, internal medicine doctors, family practitioners.
Right.
Since in just the 14 months, we've added another 12 to 15 more.
Wow.
All right, so we're going to go after this issue of primary care access by putting physicians in the more underserved neighborhoods so that folks can get to them and reach them. If we can get them insured, then we'll have the component pieces of the puzzle. But access is multifactorial. It's also about transportation.
Right. Right.
It's about knowledge and information. When do I need to go to the doctor?
Absolutely. Right.
And where do I go? And so the overarching shift is getting care delivered at the right cost point, at the right level.
Sure.
Right now, out of all the patients, and in our case, 67,000 at MedStar Southern Maryland Hospital walk into that emergency room every year. And we love to take care of them, and we want to take care of them. But frankly, 30 or 40% of those patients could easily and appropriately be seen in a primary care office, in a doctor's office.
Right.
And of all the folks that go to the doctor's office, a third of them could probably be seen at an urgent care walk-in clinic at even a lower price point.
Right.
And then of those, many could be seen by a nurse practitioner or a home health care nurse.
Right.
So the only way to get to the second overarching problem, and that's the rate of cost of the healthcare industry in general, in the aggregate, it's unsustainable. It will gobble up our entire budget, federal budget, if we don't tamp it down and find a way. So the industry, through the private and public mechanisms, Medicare for the over 65 government mechanisms, and then all the private insurers, are very actively steering patients through financial incentives to the right level of care at the right cost point.
And in our closing seconds, I did want to mention, I believe the timetable for these investments is it a 3-year timetable in terms of the expansion?
Sure. We put our certificate of need application in back in October 4th as well. And it'll be about 8 more months as we just complete the completeness questions and get docketed and go through the then county work to get zoned properly to undergo our significant expansion.
Well, I want to thank you so much for being our guest. We've had a great conversation with you, Mr. Chiaramonte. And I want to thank you and thank Southern Maryland Hospital for all that it's doing for Prince George's County residents. And please keep us updated on the progress as we continue to move forward. We are definitely bringing the world to Prince George's County in terms of health care. I'm grateful to my earlier guest, the county's Chief Administrative Officer, Brad Seamon, for for providing a progress report on the soon-to-come Regional Medical Center. And that's our program for this edition of Bringing the World to Prince George's County. Thank you to our viewers for tuning in. This program is a production of the Prince George's County Council. I'm Council Chair Mel Franklin, your host, and I'm working to bring the world to Prince George's County.